Well, good afternoon, and thank you for joining us today. The Board of Supervisors just concluded a long land use hearing, so I want to thank you for joining us at this little bit later hour, and we thank you for being flexible today with the starting time. Today is the third day of our county being under the new restrictions imposed by the state's regional stay-at-home order. We know these restrictions have upset many and are hurting many businesses. Unfortunately, as you'll see in the updates today, we have little choice. Coronavirus is a widespread disease now, and our cases have zoomed up the bar graphs and forced us into some dramatic actions. From a month ago, when our daily count of cases was in the low hundreds, we are now past 1,000 into the 2,000 range. At the Board of Supervisors meeting yesterday, we heard from doctors and medical experts, both from the county and from local health organizations, that area hospitals could run out of intensive care units. And we still have the holidays approaching when we know more people typically gather to celebrate. Vaccinations are certainly on the way, but we cannot wait for the cavalry to arrive. We've got to do what each and every one of us can do to prevent the spread of this virus. And I think by now we all know what we have to do. Wash our hands, wear the facial coverings, maintain that social distance, avoid large gatherings. No one is happy about the situation and the impact on businesses, but life is not going to get back to normal. Businesses are not going to fully reopen until we take all the steps to stop the spread. Now, I know we've shared a lot of bad news over the last several days, but today we do have some good news to share with you. Yesterday at our Board of Supervisors meeting, we received a detailed update from our public health team and other medical experts, and the Board of Supervisors took action to expand the list of industries eligible for our business stimulus grant program, particularly as more are now affected by the recent orders. To find out more about the program, you can go to our coronavirus website, which is at coronavirus-sd.com. Now we'll move on to our regular updates from Supervisor Nathan Fletcher, who will provide more good news about the status of playgrounds, followed by Dr. Wooten, and we will also have a very special guest with us today, Diane Hansen, who is the Chief Executive Officer of Palomar Health, who will update us on the status of the federal medical station. In addition, we do have available, if there are questions, Dr. Nick Efantides, our Chief Medical Officer for the County of San Diego, and Demetrios Alexio, the CEO of the Hospital Association of San Diego and Imperial Counties. And now, here's Supervisor Fletcher.
Thank you, and good afternoon. As we've all seen, a trend that's continuing is the massive and significant increase in our number of COVID cases, both increases in COVID cases, increases in ICU, increases in hospitalizations. Today we have another day of more than 2,000 cases. And it's important to put in context, it was not that long ago where we might have 200 or 300 cases a day, and now we're routinely over 2,000. And this highlights the challenge we face when we have exponential spread. It is community-wide. It is in every neighborhood. It's in every part of our community. It's obviously impacting our healthcare system. You're going to hear from one of our hospital CEOs today, and we're grateful for and appreciate our medical professionals and everything that they're doing. But what we have to do is change that trajectory, and we have to go in a different direction. The regional stay-at-home order is designed to do that, and the aim of the regional stay-at-home order is to get people to stay at home. Wearing the face covering, physically distanced, washing your hands, those are all important. We've talked a lot about riskier activities and less risky activities, but the simple reality is when you have as many cases as we have and it's spreading as fast as it is, there are very few settings that are safe, which is why the aim and intention of what we're doing right now is to try to limit the interaction of folks who are not a part of a household unit. And by limiting that interaction and by coming into this for a shorter duration, the state has set a minimum of 3 weeks. If we can come in with the focus and the attention to say things that might otherwise not be as risky, but because of how high the case count is, because the the higher percentage that if folks would gather in, say, an outdoor dining establishment, well, now the higher likelihood that someone in that group is positive, it increases the danger, it increases the risk. And so the aim of what we're doing before us is to have people have less interactions with one another in an effort to try and stop the spread and trajectory. When you think about every positive case, right, transmitting it to one or maybe a little bit more than one other person, you see that we have to take actions. And so that is the nature of what we're doing. The regional stay-at-home order is just designed to get people to stay at home. If you have something essential you have to do, you have to get food, you go to the grocery store, do it safely, responsibly, go back home. When you go to work, if you have an essential job that is not possible to work remote, then we go to work, be safe, be responsible, and then go back home. And look, we know it's hard. We know we're at the end of a long year. We know folks are tired. There's fatigue, there's frustration, there's divisions within our community. But we see what is happening to our numbers, not just here, but all we have to do is look around the state of California and look around the country at places that were in a little bit worse circumstances than us, that did not take early actions, preventive actions, did not try and intervene in the situations they are facing right now. We don't want to waste an entire year of sacrifice by getting so close to hope on the horizon with the beginnings of vaccine distribution to throw away all of that progress and sacrifice. Supervisor Cox mentioned the holidays. I know how much you love being with all of your family members, but this holiday and this season, because we love our family members and because we want to protect them, we've got to limit those interactions. We've got to change the trajectory of where we are. And by limiting the amount of folks who are interacting, it limits the potential for that virus to spread and can help us. The situation we face now is much more significant than what we faced in June and July. We know similar actions that we took in June and July were successful. We simply have to repeat them, but we have to repeat them with a vigilance that is even greater than what we did there. It was mentioned earlier, and we're going to hear from our healthcare professionals about what they're seeing. Yesterday, we were fortunate at our Board of Supervisors meeting to have a presentation from Dr. Natasha Martin, Division of Infectious Disease and Global Health at UC San Diego. And I won't share her entire presentation with you. It is available online, but I did want to share this one chart that will really point out to you what we are facing and the great concern around, in particular, the ICU utilization. And again, the capacity here that we're talking about is based on available beds, and there's a great challenge around staffing that our healthcare experts you'll hear from will talk about. But here you can see that barring no action, we were on a pace to overwhelm our ICU bed capacity just before Christmas. And that doesn't mean getting below the 15%. That means going beyond the capacity that we have. If we do the 3-week, the state had said for a minimum of 3 weeks, you can see how that trajectory changes and flattens and begins to come down. And then if various scenarios of how long we would do, you can see the present there. But I think that this chart shows us the trajectory that we were on, what we were facing as a region, and why we have to come together and come together now in order to make significant progress here. And this is certainly something we think about, we monitor, and certainly a driver behind a lot of the actions that we're facing now. There's been a lot of discussion around playgrounds. And in the state order, there was an encouragement for folks to get outside and exercise. It's important for your physical health and your mental health. Obviously, we don't want to do that in groupings beyond, again, those folks that you live with in your household where it is possible to avoid it. But I want to thank the governor and the state of California for making an adaptation to the health order, for making a change to allow our kids to be able to get out and utilize playgrounds. 3 of our 5 are Zoom learning from home, and the ability to go down to our neighborhood park and let them get some exercise and run around, play on the equipment is vitally important. And so I want to thank everyone who engaged with the state of California in a constructive way, who made the case that playgrounds should be open and that they can be done responsibly. And for all of us as parents, now the obligation is on us to make sure we use those playgrounds responsibly. You need to get your kids out. They need to get some exercise. They need to get some fresh air. We don't want them mixing with multiple households in the same place. Let's go. Let's do it responsibly. Let's go home. And let's really hold true to the spirit of the regional stay-at-home order, which is to try and limit the interaction between multiple households as we try and get this under control. With that, let's jump into our charts for today. You see an incredible testing effort. I want to commend the entire region for this, both our public health lab, our health system partners, everyone who's out there. We continue to be far surpassing the statewide average in San Diego County for testing, 7-day average of more than 24,000 daily tests being performed, working through every challenge and roadblock and obstacle. Obviously, increase in cases is not just because of an increase in testing. You see there the 7-day percentage of positive new cases now 7.4%. Total tests performed over 2 million. Case investigations, they continue to be a challenge with such a massive increase. We are moving to bring on more staffing, and we think this number will begin climbing, and we will get back caught up. But it is very difficult when you see such an exponential rise in cases. And then close contacts, again, continue to be performed well. Turnaround testing times, we've been reporting these very transparently for some time. And again, a huge debt of gratitude to our public health, our hospitals, our county Helix partnership for ensuring that these turnaround times on tests remain low. It is vitally important to the entire integrity of the real purpose of a test that we can quickly turn this around and notify people, and so we will continue to monitor those. Today, as I mentioned at the outset, we're reporting 2,104 new positive cases out of the 25,000 tests done today, 8% percentage of positive, and there you can see on the purple line the increasing percentage of positive, which shows us what's happening. And then, of course, this chart on hospitalizations, you see our ICU numbers there in yellow, total hospitalizations continuing to climb. We know that there is a delay, 21 to 24 days between increase in hospitalizations to increase in cases, which is why we really have to hunker down the next few weeks. Could be challenging as these numbers could continue to grow, even if everyone is taking action to slow the spread. But it's why we have to start now. Next one, you'll see total COVID hospitalizations on the bottom there at 915. Total healthcare system and our hospitals, as you'll hear later, are doing a lot of things to try and ensure capacity and do everything possible to maintain the integrity of our healthcare system. And then the last point you'll see here is just our ICU capacity. Again, we're sitting right there at 80%. You do see day-to-day fluctuations, but in general, this is something that we want to focus on and a primary of concern as we move forward. That concludes my update. I'll now turn it over to Dr. Wooten for a public health officer's update.
Thank you, Supervisor Fletcher. As everyone is aware, local COVID-19 cases have ballooned during the past months. We have seen rising new daily cases reported in the 1,000 since February 14th, and recently since December 3rd in the 2,000s. This first slide shows the record high number that Supervisor Fletcher shared, 2,287 cases on December 4th. And today's count also shows another high number of cases, 2,104 more cases than reported yesterday, bringing our local total to 97,549 cases. And I anticipate that this number will reach 100,000 by the end of the week. Now, the demographics for the total number of cases is unchanged. Age ranges from 0 to 107 years of age, with a median age of 35. The age range, or the groups between 20 and 49 years of age, make up the majority of the cases, currently at 56, which is going down just a bit. 58% of the cases are in the Latinx population, and 51.5 or 50,100 are female, and 48.5% or 47,150 are male. For those that have been hospitalized, out of the overall total number of cases, that is 5%, or 4,987 cases. Now, this is a cumulative number, but in just a few minutes, I will share with you what has been going on in the past month as it relates to hospitalizations and ICU cases. 1,090 of those hospitalized patients have been admitted to the ICU. Now, this number is 1.1% of the total number of cases, but represents 22% of the number of cases that have been hospitalized since the beginning of the pandemic. The total number of cases, again, includes 1,103 deaths, representing 1% of the total number of cases, and there have been 15 new deaths reported since yesterday. Of the 1,103 deaths, 96%, or 1,056, of those who died had underlying medical conditions, and the three top medical conditions are unchanged. The first is hypertension, the second is diabetes, and the third is heart disease. That leaves 4% of those who have died that had no underlying medical conditions. So logically, with the increase in cases, there have been more hospitalizations and ICU admissions. In the next slide, locally, I will briefly review the hospitalizations and ICU status for the past 30 days and the past 14 and then the past 7. But this is cumulative from the beginning of the pandemic, and where the arrow is located, we are comparing, that arrow indicates the change from the CMS in the definition of COVID-19 hospitalized cases, but we compare the last 7 days with the prior 7 days, and that percent change is 196%. If we go to the next slide, for the last 30 days. So the beginning is 878, I believe, and then before it was 297. So that is a 196% change in COVID-19 confirmed hospitalized patients over a 30-day period. For the same time period for ICUs, in the next slide, there was a 142% increase in COVID-19 confirmed cases for 30 days. The next two slides show 14 days. So from November 25th through December 8th, there was a 62% increase in COVID-19 confirmed hospitalized patients over this 14-day period. And in the next slide, for the same 14-day period, there was a 42% increase in COVID-19 confirmed ICU cases. And the next two slides shows the 7-day variation going from December 2nd through December 8th, and that is a 22% increase in COVID confirmed hospitalized cases. And for the same 7-day period, it was 8% increase in COVID-19 confirmed cases. So these numbers change every day. We calculate these numbers every day, so they do change. Now, in the next slide, we are now going to go on to our outbreak metrics, and the one in particular that we want to focus on is community outbreaks. For the past 7 days, from December 7th to December 8th, representing a total of 291 cases. And in the past 7 days, there have been, again, a total of 67 total community outbreaks. And today we are reporting an additional 6 outbreaks reported from yesterday. And this includes, in the next slide, 2 cases, or outbreaks rather, in businesses, 2 outbreaks in daycare, preschool, and childcare settings, and 1 outbreak of each sector. That includes food and beverage and retail settings. Now, in the next slide, we will go on to talk about the blueprint for a safer economy, which is the tiered framework. And I just wanted to drive home where we've gone since December 10th. And December 10th is when we went into the purple tier, and for each week, the entire state has progressively increased. And now about 51 of the 58 counties are in the purple tier, representing 99.1% of the total population of California. In the next slide, this slide shows the breakdown of the metrics, even though we are on what the state is calling an emergency freeze, but we wanted to just show you what the unadjusted, the adjusted, the testing positivity, as well as our health equity testing positivity percentage is, and we calculate that here. Our staff calculate that. The state has a hold or freeze on calculating that number, because that helps you transcend to a lower or a less restrictive tier. So in the next slide, this is the one that shows the unadjusted, adjusted, and our percentages. And again, all of these numbers have us purely in the purple tier. So this is where we are. This is where most of the state of California is at this time. I want to bring your attention to the positivity percentage. The state has us at 1.5%, and we have calculated that at 8.4%, and this is due to issues that we still have to clear up with the state in terms of how they are capturing our data. We feel that they are capturing all the negative. Our staff have looked at this, and they are capturing the negatives, but may not be capturing the positives for this particular metric. The state is aware of this, and they are working with our staff to resolve this issue. Now, in the next slide, speaking of the fact that we are in this emergency freeze, and just last weekend, the state transitioned the entire state into a regional stay-at-home order. And this stay-at-home order, it's regionally based, and it is related to the ICU capacity. So if a region has less than 15% ICU capacity, then they go into this stay-at-home order, and San Diego went into that status last Sunday at 11:59. So Southern California is at 9%, and again, that number changes from our briefings, from briefing to briefing, so we will continue to monitor that as well. If we go to the next slide, we just want to remind everyone that December 6th through 12th is National Influenza Vaccination Week. And we want to encourage everyone to get vaccinated for the flu, because if people stay healthy in that regard and are not going to the hospital if they need to be hospitalized, that saves the impact, protects the impact to our local hospitals and prevents the use of beds from these complications associated with the flu, leaving available beds open for other conditions that are non-COVID related but are serious conditions, and for COVID related illnesses. In the next slide, I want to jump in and provide just an update about vaccinations. Now, in October earlier this year, the National Academies of Science created this framework based on, with an underpinning cross-cutting health equity lens, but they created 4 phases of how they thought the American population should be vaccinated. And the first phase 1 was focused on healthcare workers and also individuals that had underlying medical conditions. That's phase 1. Phase 2 was included many critical workers. Phase 3 includes individuals that are young adults and younger, and phase 4 includes everyone else. Now, this has been modified, and actually earlier this week on December 1st, the Advisory Committee to Immunization Practices, which is a federal advisory committee to the CDC, revamped this a bit and made some improvements. So they moved phase 2 into phase 1. If you go to the next slide, this is what the new phase approach looks like. Phase 1A, healthcare personnel, and that's not just doctors and nurses. It includes anyone that is on hospital staff that might have potential exposure to individuals with COVID-19 disease. And also residents in long-term care facilities. And the healthcare personnel also includes staff at long-term care facilities. Then phase 1B includes essential workers from food sector, education, agriculture, our utilities, police, firefighters, correctional officers, as well as transportation. And 1C includes individuals with high risk, that are at high risk due to their medical conditions in individuals over 65. Phase 2 and 3 remain, as I showed you on the prior slide. The Advisory Committee for Immunization Practices, or ACIP, has met again on December 1st and only made a determination and recommendations for Phase 1A. And they plan to meet after the FDA meets tomorrow to review Pfizer's application to get the emergency use authorization. So right now, we are focused on Phase 1A. Now, if you go to the next slide, the state, recognizing the fact that the vaccines that we are going to get will not be able to vaccinate all of the individuals in Phase 1A, if we go to the next slide, we are providing titers for that category. So these are sub-prioritized areas, and they are in tiers, Tier 1, 2, and 3. And in Tier 1, the individuals or healthcare workers that we are focusing on are in acute care hospitals, psychiatric hospitals, and correctional facility hospitals. Going to the next slide, I just want to emphasize that California will be getting 337 doses of the vaccine after the FDA has approved the application by Pfizer for the emergency use authority. So we should be getting those vaccinations, those vaccines rather, next week. Out of that total number, San Diego will be getting 28,275 doses of the state's total number. Now, there was just an announcement that Pfizer is decreasing the total number that it is producing. That will not affect the first round of doses that we are receiving, but could certainly impact the second round or additional allocations. So we don't know what that will look like right now, but we will be informed by the state. Also, I would like to share that the State Community Advisory Vaccine Committee reviewed the federal recommendations for Phase 1A and approved and agreed with that recommendation. So that also is good news. And last night, our county's COVID-19 vaccine clinical advisory group met and will also be in the process of reviewing the recommendations at their next meeting, which will be within the next week. In this next slide, I just want to close by sharing with people that CDC recommends that you always practice the 3 W's. Wash your hands, watch your distance, and wear your mask. And if individuals are sick, they should stay home and then get tested. And that's very important. So do not go to work if you are sick. Get tested. And once the vaccines are available, we will let you know when individuals in other categories that are not in acute care hospital category, we will let you know when the vaccines will be available for you. So I think that is my last slide. Yes. So now please welcome to the podium Diane Hansen, who's the CEO of Palomar Health. Thank you.
And thank you, Dr. Wooten. Appreciate the introduction. And I first want to say, before I give you an update on the FMS and a couple of other things, how grateful I am and continue to be since the onset of this pandemic for the collaboration of all of the health system CEOs in the region, as well as the health system CMOs, how they've come together to really help us make the best decisions possible for the region. And the continued collaboration with our county officials has been outstanding. So I want to thank everybody involved in that. I will start by giving you a quick update on the FMS and then hopefully answer any questions that you might have. Rest assured that the 202 beds that were set up many months ago are still there and ready to go. And we've had a lot of questions about the staffing. We do have a cohort of about 50 nurses on standby with probably a week's notice that can be ready to go to staff those beds should we need them. I will say that there has been no trigger set, and we're still having a lot of conversations with many individuals about the most appropriate use for those beds. And once that determination is made, I'm sure we will communicate it out to everyone. I will also tell you that we do have capacity. We're seeing on average about 50 patients per day less than what we normally see this time of year. And I think that's important for a couple of reasons. Because while we have capacity, my biggest concern is our ability to staff beds should the pandemic surge become greater. We have an ability to expand from the dedicated 48 ICU beds that we currently have to as many as 110 ICU beds. But again, the beds are only one solution to that equation. It takes staff in order to continue to operate. I think what makes the measures so important that have been put in place, and this is where your partnership comes in, is that, while we can operate at 85, 90, 95% capacity for the short term, we can't do that for an extended period of time. So we do have a plan. We are doing what we can to ensure that we can take care of every patient that walks through our doors, but we need your help. We need your help to continue to do what's being asked of you. And I know it's difficult. I know it's a challenge. And it's a challenge for me personally, I will tell you. It's difficult when we're asked to stay at home and not visit our relatives for Thanksgiving. But the reality is the measures that are being asked of you are what we need. We need your partnership. We're going to do everything we can on our side as a hospital system and all of the other hospital systems in the area. But we need your partnership in order to make it a venture that works. We want to make sure that we're here and available for you. So I will close just by saying that we have plans to bring in more staff. Again, we need your help, and I will be available to answer any questions that you may have. I'm going to turn it over to Supervisor Cox so he can field your questions, and appreciate the time today. Thank you.
Thank you, Diane, for that update. We'll go right to the questions now.
Our first question is from Hunter Sowers with KUSI.
Hi there. Yes, I was hoping if we could get a little more clarity on what those triggers are. I know that they mentioned that they do have those available 202 beds set up, ready to go, but we're just wondering what the triggers are to where we would need to meet it for those to be indicated, and then if maybe Dr. Wooten could speak to our capacity and what it was maybe this time last year as far as ICU and hospitalizations go for the region.
Okay. We'll have Dr. Wooten go ahead and start the response to those questions.
Thank you for the questions. Now, we don't have the answer to all of your questions, and specifically as it relates to the triggers, because there were multiple questions. Number one, we may not have the answers to all. I'll start at the last one. I don't have before me right now any data to compare where we were at the same time last year. When we have a very severe flu season, which we had 17-18, we were very close to where we are right now. So we've been in this situation before, but the great thing for the public to know is that the hospital is able to adjust and adapt. And as was stated, we can sustain this type of impact for a short period of time, but not for a sustained long period of time. So that's why we are making all of the suggestions, and also why the state has implemented the stay-at-home order, so we can allow the entire system to adjust, and as we say, the curve can be flattened. Yes. We have Rob Seals, who's going to provide additional information about our hospital data.
Thank you. And just what triggers that extra bed space to be used?
For right now, what they are monitoring ICU, hospital, increasing hospitalization, as well as hospital capacity. Those are the triggers, and those are the triggers that you see on our triggers dashboard. But the one that is of most concern right now by the state is ICU capacity, and that's what we're focused on.
Thank you.
Just one point. Dr. Wooten spoke about the level of hospitalizations this year compared to previous years. And in speaking with some of the hospitals, they said absolutely, it's about the same. The difference is, in previous years, it was influenza. And when a staff member got influenza, with taking the influenza vaccine and with Tamiflu and other therapies, they were able to go back to work a week later or less. Now with COVID, and a healthcare worker
Not yet.
contracts COVID, it could last at least 14 days, if not longer. And again, it's always been about the staff and getting the healthcare workers back in. The beds don't take care of the patients, the healthcare workers do. So that's the biggest difference between this year and previous years. Thank you.
Okay, we'll go to the next question.
This next call will be from Matt Hoffman with KPBS.
Yeah, you guys mentioned an increase in available ICU beds and expecting it to get worse in our county. When are you expecting the county to run out of staffed ICU beds? And when that happens, like, what exactly happens? Like prioritizing patients or turning some away?
Okay, Dr. Wooten's going to respond.
I'll give it a start. Well, in some of the, well, one in particular in the slides that Supervisor Fletcher shows, it shows where our licensed beds numbers are, and then it shows what our capacity, our hospital capacity, or bed capacity. If we talk about ICU specifically, you heard today that we were at 80%. So that's 80% of the 100% capacity. And we know that we have 60%, and let me just also understand, that 80% includes you have patients in the beds, you have the beds, and you have staff. We know that of the remaining 20%, we have a 6% capacity, which means we have staffing for 6% of the beds out of that remaining 20%, which means there are 14% where we would have to, or the hospitals then would have to determine how are they going to staff those particular 14% beds. So that is the issue and the kind of chess game that has to be played if we reach that point. And the hospitals have a plan for that. So it's not like they're just sitting around saying, what are we going to do when that happens? They have a plan if that occurs.
And then kind of
Matt.
following up on that, looking at the SoCal region's ICU capacity, just at 9% right now. Does that mean that we'll start seeing patients being transferred to our county from some of the other counties that are seeing their ICU beds really low?
Yeah, Matt, I'll have Dr. Witten or someone address that. But if we can go back to your original question, if we can pull up the slide here from Dr. Martin, because I think your question was, at what point do we think we'll overwhelm our ICU capacity? And it really depends on our ability to adhere to the regional stay-at-home orders. You can see right there that had we not taken an action with the trajectory we were on and the spread we were experiencing, we would have overwhelmed our healthcare system, our ICU system, right around Christmas. The hope is, with the regional stay-at-home order, that we can bend that curve and not get to a situation where we overwhelm our ICU beds. As it relates to the question about previous years or the average year, it's important to keep in mind this is not an average year. This is not an average situation. This isn't an average circumstance. In the average year, you don't have a global pandemic that is having an exponential daily rise in the number of ICU beds that are being taken up. In a normal year, you don't have, as was mentioned, staff having significant challenges of burnout, of getting sick themselves. We also are at a place now where our capacity now is being impacted because a lot of hospitals are making decisions to delay less urgent procedures in order to try and keep that ICU capacity there. And so it's important to recognize there's nothing average or normal about what we're facing. And based on the projections, if we can have success in the regional stay-at-home order, the hope is that we don't overwhelm San Diego's healthcare capacity.
Okay, next question.
This next question is from Brandon Lewis with Channel 8.
Thank you. Can you expand a little bit more about why the contact tracers are falling behind rather, and how the county is going to meet its goal? I think Supervisor Fletcher said they hope to meet it within the next few weeks. And then also maybe if Dr. Wooten can clarify her comments about this being unsustainable for the long term and short term. Can you just maybe quantify what is long term and what is short term?
Okay, Dr. Wooten is going to respond to both of those questions.
Well, first, during any flu season, we have, our peak is between December and January in some years, and then January and February in others. And usually that's anywhere from 3 to 4 weeks. So that's what I'm talking about. We can sustain that, but we cannot sustain months on end of what we're seeing currently. So I hopefully that answers your question. And then what was the other question?
It was about contact. That did answer my
Oh,
question.
yes.
My other question was about contact tracing. Yes.
Yeah, absolutely. So right now, last week we brought on 30 more case and investigators, and our goal is to bring on an additional 100 case investigators, and we should have those on, I believe, by next week. But the case investigation can be anywhere from 2 to 3 hours, and we've added on more questions. Typically it was about a 2-hour interview, where we also ascertain the close contacts. Because we've added on more questions that are reflective in the COVID-19 watch on the page where we ask individuals about their potential exposure, the interviews are taking longer. So in general, a case investigator may be able to take anywhere from 4 to 6 cases a day. But given the fact that we had the increase, I mean, we had the increase back in July, and we thought that was bad, and then comes December, and now we are over 2,000 cases in any given day. That's where the backlog occurs. So that's, again, we are bringing on more people. Previously, we had actually a higher number of case investigators. But, you know, as people drop off, we have to add them back on. So the timing with the 2,000 plus daily cases requires us to bring on additional staffing. So we hope to, we've maintained between 56 and 27%, and with bringing on additional staff, we hope to get back up above the 70%, which is our triggers target. Or I shouldn't say target.
Thank you, Dr. Wooten.
Our threshold. Thank you.
Thank you.
Okay, next question.
This next question is from Kasha Gregorczyk with Fox 5.
Hi there, good afternoon, everyone. Can the county provide an update on the current status of the strip club injunction and the county's stance on how to move forward with guidelines regarding strip clubs? As we have observed, there may still be some indoor operations going on.
Okay, Supervisor Fletcher is going to respond.
Thank you. The county public health department, we didn't view strip clubs as essential. They're also clearly higher risk. I'm guessing that most folks aren't going there with all the members of their household. So you have multiple households interacting together in a high-risk setting, and so we ordered them closed. We felt that that was consistent not only with common sense, but with the public health order. A judge overruled us. A judge issued a temporary restraining order on the county, barring our enforcement of our closure notice pending an additional hearing. We have a hearing coming up before the judge where we will get a more definitive ruling and have a greater sense of what that looks like moving forward. The County Board of Supervisors, as was reported out in open session today, voted 3-2 that if we lose this hearing, we will appeal that hearing, which means the majority of the Board of Supervisors do believe that strip clubs are not essential and ought not be open in a time when we have a regional stay-at-home order and a global pandemic, and we will continue to advocate in the courts for what we think is in the best interest of public health. Thank you.
Okay, next question.
This question is from Paul Sisson with the San Diego Union Tribune.
Thank you. As we heard from Dr. Martin at UCSD yesterday, her modeling and other modeling is showing that our ICU occupancy rate and our hospital occupancy rates are likely to be fully occupied by Christmas, and there's really not a lot we can do about that. All decided to stay home today and wear our masks, because of the 2 or 3 week lag time in hospitalizations. The results of our actions wouldn't be seen for 2 or 3 weeks. So given that situation where you can pretty much count on the fact we're going to run out of beds here this month, can you talk a little bit about what your triage thinking is, especially as it pertains to delaying scheduled procedures for people who do not have COVID? Is there a point coming soon where you're going to say, okay, new COVID patients need to go to the surge hospital floor at Palomar? To what extent can you justify delaying someone's cancer surgery for someone who didn't follow the health orders and got COVID?
Okay, Supervisor Fletcher is going to start off answering that question.
Yeah, thank you for the question. If we'll pull the chart up again. I think the black line there that shows us overwhelming ICU capacity, if you see at the top right there, it says if no action were taken. And so I think the hope is with the stay-at-home order, which you see represented there in the merge of the orange and the blue line, is that if we have a successful regional stay-at-home order, our hope is that we can avoid the situation of overwhelming the healthcare system. These are one of the charts. Dr. Martin walked through a variety of charts yesterday, but this is the one particularly as it relates to ICU beds. And this is what we're hoping on. If we have a successful regional stay-at-home order, if people avoid mixing, if we can slow the transmission, then perhaps we can get through this without overwhelming our ICU capacity. As it relates to the second half of your question, Demetrios is here, who's going to address that for us. Thanks.
Thank you, Paul, for the second part of your question. As it relates to the time-sensitive procedures, those orders haven't changed since earlier this year. And essentially where we're at is those are decisions that our medical professionals need to make in terms of what procedures are delayed and what aren't. And our hospitals are already doing that. It's really dependent on capacity, where they're at, that some of those are already being delayed. But it's really on a system-by-system basis based on where they're at capacity-wise.
I get that, and I get that that's been going on, but I guess what I'm wondering is, as the county health department, you guys say at some point, okay, no more delaying, surgeries for people who don't have COVID. We're going to shunt all of the new COVID patients to a lower standard of care area with cots or what have you. At what point, do you reserve the standard of care kind of care for people who have something other than COVID?
So, Paul, I don't know when that will happen, but if it does, and if there is a need to make that determination, the county health department will work collaboratively with our healthcare system to determine what actions need to be taken. Again, as Demetrios stated already, hospitals are making those determinations already, but if we reach a 100% capacity or approaching a 100% capacity, we will make that decision collaboratively about what actions need to be taken. Just recall again, in the health office's order, it already has a language about, and this is based on the state's order, but it has language that gives hospital the capacity, and it doesn't say anything about elective surgeries. It basically gives the hospital the capacity or the authority to make the decisions themselves, because they know best about what surgeries can be delayed, and many surgeries can't be delayed much longer because they've already been delayed, and if they are delayed much further, they become there becomes an issue to the health of individuals. So again, we will make that decision collectively.
Dr. Wooten, how close do you think we are to reaching, a crisis situation where you have to start making those hard decisions in the moment about who's sicker and who needs to care more urgently, and suddenly you have to make these tough decisions that we've seen in a lot of other states, first New York and then other states in the Midwest as we move,
Paul, I wish I had a crystal ball to tell
late
you.
fall.
If we do nothing, as has been stated by the modeling, we will reach capacity by Christmas. That's if we do nothing. We have done something. We've implemented the stay-at-home orders, so we will continue to monitor the statistics and report out to the public, to you, the media, and to let people know where we are, and we will continuously work in collaboration with the hospital systems to take any additional actions that need to be taken. But the hospitals are currently taking the actions they need to keep that balance with bed availability in their systems.
Thank you.
Okay, that was our last phoned-in question. We do have a couple of texted questions. This first question deals with what the schedule for distribution of the vaccine once it's available will be, and Dr. Wooten will answer that.
This question is from Jennifer De La Cruz with ABC 10 News. What are the county's plans and timelines for vaccine distribution? We're hearing from healthcare workers that they've been told they could get it as soon as next week.
Can you go to the slide that talks about the distribution? So first of all, 327 or 320,000 vaccines are coming to, next slide. Next. Okay, right there. Yes, 327 doses are coming to the state of California. So whenever that occurs, when the state, the vaccine is actually going to come directly from the manufacturer. The CDPH has worked with local health departments throughout the county to identify who are the recipients of the first doses of COVID-19 vaccine. And if you can go back to the last slide. Yes. So the first phase is, again, healthcare personnel, nursing home residents, and nursing home employees. So, and in the first phase, there are 3 tiers. We are not even getting enough doses for that first dot point in tier 1. We are basically getting about 70, just over 70%. And the math is, if you go back to the slide, this next slide, we're getting 29,275 doses, but there are about 39,000 individuals that fall into that first category of acute care hospital personnel. So that's about 72%. So we have asked the hospitals already, and you don't just get the vaccine, you have to sign up in the CDC's COVID Ready database, and then you have to sign up and ask or indicate how many doses you need. Now, just because you ask for X number of doses doesn't mean you always get that. But that has already been conducted by our staff, working with the local hospitals, and medical providers in the general community are not on the list yet. So again, it is only those providers that are associated with, in the slide before this, acute care hospitals, psychiatric hospitals, and correctional facility hospitals. We don't have a correctional facility hospital in San Diego. So primarily it's those first 2 categories, acute care hospitals and psychiatric hospitals. And that's where the first round of vaccines will go. The vaccines will go out after the Food and Drug Administration, or the FDA, meets tomorrow, and if they approve the recommendations that have been approved or recommended by the Advisory Committee on Immunization Practices, if they approve, the FDA approves if they approve the packet from Pfizer with all of the data from the first, second, and third trials. If all of that is approved by the FDA, then the vaccines, Pfizer vaccines, will receive the emergency use authorization, and then after that, that's when vaccines will be delivered. Now, you've heard on the news that Pfizer states that they will ship out the vaccines within hours or 24 hours of getting the approval. So we anticipate that sometime next week, early next week, if not on the weekend even, that we will get vaccines. But once we get vaccines, those vaccines will go to 3 locations, and these locations are what CDC calls pre-positioned locations. So that's Rady's Hospital, UCSD, and of course our county hospital. And then those individuals that have already been approved by CDPH will receive their vaccines. And again, these are our health care systems.
This next question is also for you, Dr. Wooten. Jonathan Wozen from the Union Tribune asks, given Operation Warp Speed, officials saying today that initial 2.9 million Pfizer vaccine doses will be sent out nationwide, not 6.4 million, does that roughly cut in half the 28,000 doses the county expects in the first shipment?
Thank you for that question. No, it does not. That allocation has already been determined and will be going out. What will be affected will be the subsequent distribution of Pfizer's vaccines, but we don't know the answer at this point in time of how many we'll get, but once we get that information, we will make that information public.
Okay, and this question is from Richard Allen at CBS 8. Roughly 40% of Americans at this point say they are unlikely to get the coronavirus vaccine, many citing any potential side effects as their reason not to get it. How does the county plan to assuage any fears San Diegans may have regarding the vaccine concerning potential side effects, especially considering that 2 doses of the vaccine are necessary to be as effective? For example, for even those San Diegans who initially do decide to get it, any unanticipated side effects from the first shot could deter people from going back for the second.
Yeah, thank you, Richard, for that question. I'm encouraged that recent polling in San Diego shows we're in a much better place. One I saw just a couple weeks ago had, I believe, more than 70% of San Diegans said they'd be willing to take the vaccine. The number of folks that were concerned was closer to 20%. The number one reason that approximately 20% gave was they just didn't think there had been enough time. Well, the reality is we're watching it now. We're watching the vaccine go in other countries. We're perhaps as early as next week going to watch healthcare workers get it. And it is going to take many months before it is widely available to the public. And we think over that time frame, confidence will rise. And we have a very focused effort here at the Public Health to build confidence, to collaborate. We have a clinical advisory group working with medical experts. We have community advisory groups. We're engaging with community groups, working with trusted messengers. And so we think that over the duration of this, we'll be able to build that confidence. And, you know, at the end of the day, when it's shown to be safe, when the healthcare experts have said it's safe, when we've been able to watch people take it, you know, we're all going to be faced with the reality that we want to get our kids back in school. We want to get our businesses back open. We want to get life back as we knew it and be through COVID. But that is going to require herd immunity, which is a significant number of people. And we're confident that a lot of focused, dedicated effort can get us where we need to be in the county. But we're certainly in a much better place in San Diego than certainly the nation as a whole based on the numbers you shared.
Well, that concludes our questions for today. We will be back here next Wednesday at 2:30. Again, we apologize for the lateness of the start of this, but just because of our board meeting going a little bit longer than we anticipated. And again, a word of encouragement. Let's all hang in there. Let's keep fighting this fight. Let's make sure we do the things we can do, which is wearing those masks, maintaining the social distancing, washing your hands, and avoiding large crowds. Until next Wednesday at 2:30, we thank you for your participation.